Thanks, Corey. A family history can play a role in increasing the risk of cancer being passed on from parents to children. Cancer genes can be difficult to understand because having the genes doesn't necessarily mean you'll get cancer.
At Mercy's Hall Perrine Cancer Center, oncology genetics experts can help patients and families understand their cancer risk. Joining us this morning is high-risk oncology genetics practitioner, Amy Haas.
Yes. Hi, Amy. Thank you for being here.
Thanks for having me.
Tell us, what role do you play in helping patients determine their cancer risk?
So the role of the high-risk oncology genetics nurse practitioners at Hall Perrine is to really assess a family and a patient to identify if they have inherited risk, as well as helping family members who may have had family members die of cancer and determine if they have risk because of that family history. So we do two parts. We assess the patient and the family, talk a lot about family history, get more information from them about that, and then do genetic counseling. So counseling involves talking to them about a DNA test and what those results could mean for them and their family members.
So what are some of the most common types of cancer that can be detected by these tests?
So DNA testing is very common. Mutations are found with breast, ovarian, prostate cancer, pancreatic cancer, colon cancer, and uterine cancer and urinary cancer. So there are several different cancer types. We are more finding mutations possibly in younger people diagnosed with cancer with an earlier age of onset of their cancer diagnosis, or even in strong family histories at any age. So we are really testing more and more patients every year compared to where we were in the past to identify these mutations.
Well, one you mentioned was pancreatic cancer, which I know that is...
It's very challenging diagnosis.
Right.
Difficult to find in the earlier stages. So if we can identify risk and maybe be able to identify at an earlier stage, that may be helpful, or just to give information to family members, because pancreatic cancer can be very connected to breast cancer and even ovarian cancer. And those cancers we can possibly detect or even prevent.
Right.
Wow.
And what are the potential outcomes of genetic testing?
So genetic testing is a blood test, and it is sent to a commercial laboratory that analyzes that DNA. But also we take that result, and if we find a mutation, help guide that patient to know what their risk is, as well as what their other family members may have for risk overall. So if we can give that patient information and family information, it really is knowledge to know what their risk is, and having that knowledge could help determine what is the right screening.
And figuring out to do with your test results, your genetic test results, I'm sure can be difficult. What are the issues patients face when they learn that they carry the cancer gene?
So if they have been found to have a cancer genetic mutation, many people think that is a bad outcome, but really it is providing knowledge and understanding. So we think of knowledge as power, and that power can help really identify if they have additional screening recommendations that we can provide. Could we connect them to experts within our cancer center to really be talking to them about management of that cancer risk? It could be a preventative surgery. For example, people with ovarian cancer risk, there's no way to screen for ovarian cancer. So the best way to really treat that is to do a preventative surgery.
Sure.
And then, so how do you advise your patients to talk to their family members about this?
So very important. We at the Cancer Genetics Clinic see our patients as not just individuals, but we are really managing a whole family. So we will provide counseling and testing for the entire family if they live in our region or in our area, and we can get that testing for them so they would know exactly what their risk is.
Okay. One thing I think would concern a lot of people, cost, insurance. Does insurance cover the testing?
Yes, so health insurance has improved greatly in their coverage of genetic testing, more so than it has ever in the past. And the overall cost has gone down with inherited genetic testing with commercial laboratories. So we definitely can get a person tested. And 90% of the patients that we test probably pay $100 or less for their DNA testing.
That's not a lot for what you are able
for the
to
service.
provide.
No, absolutely not. So that's great news. I think that might deter some people from actually getting the test.
It's important, and it doesn't necessarily mean you will have cancer, but it's important to know. And we thank you for being here and
Yes,
giving
thank
us
you.
all
Yes.
that information.
Yes, and our contact information is there if you need to get in
Yes.
touch with us, or the website at Mercy Medical Center.
Yes,
Okay.
and people
Yep.
can call and visit
Yep.
the website to book an appointment.
Yep, thank you.
Thank you,
All right.
Amy.
Thank you so much.